We continue tracking rising COVID cases here in Ohio, and now we know that some people who've spent time in the intensive care unit with the virus may develop PTSD. Zainab Shaib spoke with a psychiatrist with Mercy Health. And Zainab, you're here to explain a little bit more about what this means for these patients and maybe even their families.
That's right, Tiffany. You know, this pandemic, COVID-19 pandemic, has really pushed some of the researchers to look even more closely to the survivors, the COVID-19 survivors, and the impacts that it had, as some of them might even have PTSD. Now, post-traumatic stress disorder, or PTSD, may occur in people who have experienced a traumatic event. COVID-19 hospitalizations is a potentially traumatic experience, especially in severe cases. Increases in mental health conditions have been documented among COVID-19 survivors who were admitted in the ICU. Now, I spoke with a doctor with Mercy Health, and he explains that COVID-19 may have a long-term impact on our health and neurological systems or mental health conditions, including difficulty thinking or concentrating, headaches, sleep problems, and even loss of taste and smell.
There are neurological conditions that can be triggered by a COVID infection. And now we are seeing evidence that there may be an increase in the risk of dementia in patients who have had COVID-19. And of course, you know, as we have more time, we will get more robust data and have a higher level of confidence in our correlation and know that this is actually happening.
Now, he also mentions if you are constantly reliving flashbacks, nightmares, and even involuntary memories of when you were in the ICU, when you had COVID-19, then you should reach out for help and consult your doctor immediately. Live in East Toledo is Zainab Shaib for WTOL 11.